pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
This is just a new law that passed or started 2024 AB 716.
Okay, that is special. That is a special law. So there's no way to put that.
That's special. That's a special law. I couldn't agree more. Is medical insurance just a scam now? Allegedly, in my opinion, that's what it feels like. So scrolling through social media, I found an extremely alarming video. At the time of filming this, the video itself went live on TikTok about 3 days ago, 2 or 3 days ago, and it has already amassed 20 million views. And that's just on TikTok. It was also brought to my attention that it is also going viral on Twitter, but at a much slower rate. I think it might have 1 or 2 million views as of right now. And I wanted to bring it up today because it's shocking and it really makes me think that the problem with healthcare in America is just way worse than any of us thought. Even the simple act of riding in an ambulance can cost thousands of dollars depending on the severity, location, and whether or not the person being transported is insured. I actually have some personal experiences with this. When I was a young mom, when I was, only 20, 21 years old, that was a period of my life where I did not personally have health insurance. And I did have to ride to the hospital in an ambulance. I had to visit the emergency room a time or two because I became so ill that was the only way that I could get seen by a medical professional because I didn't have insurance. I couldn't just, go to a family physician and get a checkup. I had to just resort in going to the emergency room because when you don't have insurance, you basically have to treat the emergency room like a clinic. At least you did at the time. I know that there are a lot of emergency clinics and everything now, but that wasn't an option for me back when I was in that phase of my life where I was an adult living on my own, a young mom nonetheless, and I needed medical care. And I remember getting the bills for these instances and just being absolutely flabbergasted and thinking to myself, how am I ever going to pay these off? There's no way. There's no way I can pay for a $500 ambulance ride coupled with $300 in supplies, coupled with this, coupled with that. Even the act of walking into an emergency room was $300 just to walk in the door. So ever since my experience with that, I have always, made sure that I have had health insurance because I never wanted to be in that kind of situation again. Having these medical bills just stacking up, the debt just stacking up, and always having it just leering over me and praying to God that I didn't get sick again. I always knew that the United States had a problem with their healthcare, but I didn't realize it was this bad. So this gentleman's TikTok is called These Few. And before I even start the video, the caption reads, "This is not satire. This is the state of healthcare in America for a life-saving ambulance ride for my daughter. The state of California is penalizing citizens who have insurance." Now, he clearly says that he is in California. However, I don't think that this is limited to just California. I would have a strong suspicion that this would be something that multiple state residents, not just California, would expect to have happen. So let's watch and see what's going on.
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600.
I love how the representative on the phone even sounded confused and said, "Went up?" That's how idiotic this situation is. That's how idiotic the situation is, that even a representative from the insurance company was kind of taken aback by what he said.
Was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, sir, you're insured.
So not only did the situation go awry because the price went up as soon as it was sent through again with insurance. So the price went up when it was sent through with the insurance, but the amount that the insurance was willing to cover still left this guy with a higher balance due than if he wasn't insured at all. So I can almost see this not being as big of a deal. Okay, I know that's gonna, before you come for me in the comments, what I'm saying is I can almost see this not being that big of a deal if they are just charging insurance companies more, if it reduced his out of pocket. So if the ambulance ride was $600 and then maybe they charged insurance $2,000 and then insurance ended up paying $1,600 and so he ended up with only a $400 bill, he would then be paying $200 less out of pocket because the insurance would cover. So, I mean, in this kind of situation, as long as you're insured, it's kind of like, okay, the hospital's going to charge the insurance company whatever price they want to charge the insurance company. You know, it's going to be price gouging the insurance company as long as the individual who is insured is paying less money out of pocket and is actually seeing the benefits of having a policy, then okay, maybe we can justify it in that sense. But that's not what happened here. As soon as insurance was ran through the bill, they upcharged the ambulance, and now he is having to pay more out of pocket because the insurance company didn't cover as much of that ambulance ride as, you know, you would think. So,
Can I go back to the discount without the insurance?
No, sir, you're insured, so you're not eligible for the discount.
okay. Honest question this guy's asking. I mean, I would want to do the same thing too. Hey, can I just go back? Like, can I just go back and say, okay, pretend like I never gave you my insurance? Because remember, the whole reason why he got this bill for $600 was because the hospital had billed him not having insurance on file. So the hospital thought that he was uninsured, sent him a bill with a cash discount because he didn't have insurance. So the mistake that this guy made unknowingly, he had no idea that he was making this mistake, because who would have thought this would ended up like this? But this guy, you know, was like, oh my gosh, I got a $600 bill. I better, you know, make sure that they have my insurance so it can get run through. So hopefully I pay less. And in turn got screwed over out of more money because now he's being told, no, I'm sorry. Now that we know that you are actually insured, we can't give you the cash discount. We can't pretend like we didn't know that you were insured and revert you back to the original price that you were once at, because now we know that you're insured and now we're not going to give you that price. That's so skeezy.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Okay, another honest question. So, hey, if I go cancel my insurance, will you then give me the cash discount for being uninsured? Nope, because you were insured at the time of the accident, because you were insured at the time of service. Therefore, nope, sorry. Sorry, we can't give you that cash discount still. I'm absolutely flabbergasted, and I'm shocked that I'm as flabbergasted as I am because I knew the state of our healthcare was skeezy and sleazy and in all ways unappetizing. This is just nasty.
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
This is just a new law that started 2024, AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentives straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir.
It's this.
You should cancel your insurance. I'm just letting you know that that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that.
That's special. That's a special law. I couldn't agree more. I don't know if this is if they're seriously intending a law like this to screw over people who are insured, or if they're genuinely trying to cut people that don't have insurance a break, and they had to draw such a hard line in the sand that it ended up screwing over one side of the population while helping the other. This is absolutely idiotic. It's idiotic.
So there's no way to put that discount onto an insured person. Only the uninsured people get that.
Correct.
I am at a loss for words. I am at a loss for words. This is absolutely mind-boggling. Let's see what some of the comments are on TikTok. How are people responding to this? Yeah, this guy says, the fact that they can discount $1,700 so easily proves that this is just an insane markup. And then the next commenter says, I'm convinced there is zero logic in American healthcare. I agree. This person here, this is the logic. And because we didn't even talk about insurance premiums, because you pay monthly for an insurance premium. And this person says, so paying a bigger monthly premium for the benefit of a bigger bill. Cool. I know, it's logically, you think that the act of paying for medical insurance means that you would get, as a result, a lower bill. But this poor guy, just like I'm sure lots of other people that have been in this exact same situation, but they might not have known that they were in the exact same situation because they sent it through their insurance first. They didn't get the option to see a cash discount. Not only is this guy paying monthly for a medical insurance premium, but he is now also paying more for medical services. Make it make sense. Make it make sense. Is medical insurance just a scam now? Allegedly, in my opinion, that's what it feels like. It feels like paying for medical insurance is a scam, especially with all of these urgent care places popping up all over the place now. Is that the better option for us to use? Will that result in us paying less out of pocket when there's a medical emergency? Let me know what you think. Am I losing my mind? Am I taking crazy pills? Oh my God. So here's the thing. So I actually have a personal thing that I want to share that is kind of related to this. It has to do with how easy it is to just suddenly discount something. You know, the fact that they were so easily able to discount this ambulance ride when they thought he was uninsured, you know damn well they could just hit a button and discount it back down again. But they won't, because they know that he's insured and they want the money. So here's something that happened to me that really showed me how easy it is for them to just, and by them, I mean people in the medical field, prescription, healthcare, all of that, just with the click of a few buttons, lower the price. At the time, I don't anymore, but at the time I had a regular prescription that I was taking. It was on a 90-day supply, and I was using Walmart's pharmacy at the time. No longer, but I was using Walmart's pharmacy at the time. The prescription was normally $27 every single 90 days with the kind of insurance that we had. Well, at the time, my husband had lost his job. We were kind of in between insurance, and I didn't have coverage for a short window of time because we were trying to find a new plan. Well, I needed to get my prescription, so I wanted to have it refilled and see how much it was going to be without any sort of insurance coverage at all. Without insurance, my prescription auto refilled for a 90-day supply. And then I got a text from Walmart's pharmacy letting me know that my prescription was ready for pickup. And it told me that my balance due was $485 for a 90-day supply of this medication. Again, I was used to paying $27 with insurance. I could not believe how expensive it actually was. So I ended up calling Walmart's pharmacy because I wanted to make sure that the price was right. Like, is this actually the price? So I called them and I said, okay, I just got the text that it's $485. I just wanted to make sure that this was for a 90-day supply. I'm used to paying $27. I didn't think that the medication was that expensive. And after talking to her, I happened to use the words, is there a coupon code or a good RX number that I can use to bring that down. After a very, very brief pause on the telephone, she says, let me check good RX. I hear some clicking, and then she comes back and says, there was a good RX number. I was able to apply it to your prescription. Your total balance due is now $45. True story, you guys. I am not blowing smoke up your butts. The bill went from $485 for a 90-day supply down to 45 bucks. That's a 90% savings. And it wasn't because of insurance. It wasn't because I was somebody special. It was because they typed in a freaking number on a GoodRx website, which GoodRx, if you didn't know anything about it, it is not a prescription plan. You don't pay a subscription cost for it. It is available to anybody that basically searches for a prescription and there's a number that's eligible to bring the price down. That is it. That is it. So all I had to do was say the words, is there a promo code or a good RX number that we can use? And within seconds, she was able to find a number, type it in, and knock my price down 90%. It is shady, it's dirty, it's disgusting. Had I not asked her to find a good RX number to bring my bill down, I would have paid almost $500 out of pocket for my prescription. But just because I uttered the words asking about a good RX number, suddenly 90% of it goes down and I get there and I pay $45 for a 3-month supply of my prescription. Our healthcare system needs to be overhauled. This is bullshit. It's bad. It's really, really bad. And we all need to be paying closer attention. We need to be asking more questions so that we don't get screwed over. Let me know your thoughts on this down in the comments below. I am sure that a lot of people are gonna have a lot to say about this. Have you seen this video before I brought it up? Like I said, it is blowing up across all social media platforms, so it would not surprise me if you've seen it already. And it's alarming. It is absolutely alarming. What do you think? Is it better to be insured or be uninsured? I mean, logic tells me it's better to be insured in case something bad happens, you're not bankrupt. Like I said, I've lived that life. I've lived without medical insurance before. I've had to go to the hospital. I've had to ride in an ambulance. I had the bills stacking up because I couldn't afford to pay them. Would it have been better or worse if I was insured at the time? I don't know. I'm starting to like question everything now. I don't even, wow. I know this was a really hard topic, but if you like videos like this, please make sure to hit that thumbs up before you leave. I greatly appreciate it. I will make sure to link his TikTok down in my video description below, so you can go give him a follow. Don't forget to subscribe if you have not already. Ring that notification bell. That way you're notified whenever I post my next video. Thank you guys again so much for watching. I will see you in the next one. Bye.